This is Raymond Donald Hong for Health Matters. Reporting of AIDS-related topics have usually centered around gay men, but the AIDS pandemic also affects women and transgender people. Lyon-Martin Health Services is the only freestanding community clinic in California with a specific emphasis on lesbian, bisexual women and transgender health care. I sat down with Medical Director Don Harbatkin to talk about the clinic's services for women and transgender people who are HIV positive.
In thinking about HIV in women and in transgender people, I actually think that the disease process itself isn't all that different, but the ways that people get it and how it affects the rest of their life, I think, is very different. We continue to run an HIV primary care program, which incorporates both a medical aspect to it, a case management aspect to it, and a support group, drop-in lunch group. Women and transgender women specifically, come in, they get a hot meal, they have a peer support group. There's usually a speaker that comes in and talks about community services or talks about some aspect of HIV. The women in that group have been coming for 10 or more years, every week, regularly, for all of that time. And the things that they talk about in the group are a little bit about HIV illness, a little bit about disease management, a little bit about safer sex, a little bit about their HIV meds, but they talk more about their psychiatric meds. They talk more about the fact that they're homeless. They talk about the fact that they're trying to manage their substance use. And I think that those factors, while they are HIV positive, those other psychosocial factors have a much, much bigger influence in their lives than the HIV disease does. And I think that's very different than in men.
Over the past year, Lyon-Martin Health Services have seen 2,000 women and transgender people. Half of them are identified as lesbian, bisexual, or transgender.
The HIV program that we run here is actually the smallest part of what we do. The biggest thing we do is we're a women's health clinic, and we also have a transgender program in among the services that we provide. We do HIV counseling and testing as a part of routine primary care. For most of our women, they don't consider themselves to be at high risk. They come in asking for the morning after pill, which clearly shows that they had unprotected sex that they're worried about, but yet they don't then associate that with a risk of an illness, the risk of getting HIV, the risk of getting a sexually transmitted infection. For a lot of those heterosexual women, it's still really about pregnancy and much less about HIV. For our transgender patients, I think the picture is really, really different. In and among the routine testing that we do for primary care, all of the tests that we have done in the past 2 years that came back positive were in transgender women. Their risk is very, very high. And I don't know that they recognize their risk in the same way that gay men do, or perhaps they don't prioritize that risk in the same way that gay men do.
Another increasing high-risk group is transgender men.
In transgender women, we knew that this was a high-risk population, but what we've started seeing, I'd say, over the past 2-3 years is transgender men being at risk for HIV and being infected with HIV. That as newly transitioned men, they are going out and having sex with gay men, which then becomes a different set of skills that they need to negotiate sexual activity than they had previously before transition. And they're taking much higher risks, either because they don't know how to prevent them or to get gender affirmation around being male, and is resulting in higher rates of HIV infection among trans men who have sex with men, which I think is a new and emerging group of people that we're not well equipped to handle. And how to do HIV education and HIV prevention with this group, I don't feel like we're that equipped to handle, and should be an area that we're exploring more.
Being HIV positive is no longer a death sentence anymore, but getting tested and knowing your status is necessary.
My experience in giving positive test results to people, especially people who aren't expecting them, is that they are immediately overwhelmed and hear nothing else that I say. And so the key thing is to breathe. I think the next step is to find support and to have someone who they feel that they can talk to and a plan for the rest of the day. And so often when I'm doing someone's first test or test that I'm concerned about, I'll have them identify the person that they're going to talk to after their test, even before the test results come back. As we move into rapid testing, we're talking about ways to have people bring support people to that visit so that they can have support there, or at least have someone identified that they're going to be able to call or talk to on the phone if their test result becomes positive. I think that part of being able to really prevent HIV from spreading is knowing your status and then being able to make informed choices based on that status, which means if you're engaging in high-risk behaviors to get tested more regularly, if you're engaging in low-risk behaviors to get tested still regularly, though less often, but the key thing is to get tested and know your status.
In San Francisco, this is Raymond Donald Hong reporting for Outlook Video.